All right, welcome to another Medical Director Minute. My name is Dr. Brian Everett. Today we're going to talk about the COVID-19 variant. So we've been talking about COVID-19 for quite a while now, and as the virus changes its genetic makeup, it changes the way it interacts with different components, including how contagious it is, how it changes with our ability to fight it and interact with diagnostic tools. So the CDC has kind of decided that there's going to be three different groups of variants, variants of interest, variants of concern, and variants of high concern. And what makes these different variants depends on how it interacts with our tests, treatments, and vaccines. So the COVID-19 is considered a variant of concern. Specifically, there's evidence that it impacts the diagnostics, treatments, and vaccines. We'll kind of go through each one of these. The first one being that it seems to be more contagious than the original COVID. In fact, there's a COVID variant Alpha that was found in Britain, and it was noted to be about 50% more contagious than the original COVID-19. COVID-19 Delta is from India, and it seems to be about 50% more contagious than that Alpha variant. So that means that if one person was in a room with a couple other people, they had the potential to affect about 3 to 4 people, whereas the original one was about 2.5. What this really kind of comes into play is that we think that there may be these areas of localized high infection rates, specifically amongst communities that have low vaccine rates. The reason being is that they can easily affect a bunch of people real fast. There's also the potential that our monoclonal antibodies and vaccines may not be as effective because of the potential reduction in the ability for those treatments to neutralize the virus. So it's kind of hard to say exactly how much that is affected, but we do know that it's being affected by the COVID-19 variant. However, vaccines still confer protection. If you are vaccinated, especially if you've had 2 of the series, if it's Moderna or Pfizer, there's increased protection. Those that are unvaccinated have the increased risk. This changes daily, of course, but that's why Pfizer is looking at possible boosters in the future. And this kind of gets onto the idea that there's a lot of unknowns that change daily. For example, it's too early to say right now how the hospitalizations and death rates are affected with this new variant. We don't know if patients are going to do worse in the hospitalizations. Are they more susceptible to death because of this new variant? It's too early to say. And again, it's too early to know whether or not we're going to need a booster. That being said, it's important that we continue to have a high suspicion of these patients having COVID-19, especially in the unvaccinated patients. If you're going to someone with a breathing problem, flu-like illness, those are patients we need to make sure that we continue to wear our N95 masks, disinfect our gear afterwards, and continue to wash our hands and do best practices when it comes to viral concern. That may include putting the viral filter on if we are doing airway maneuvers. If you're not vaccinated, I encourage you to talk to us, encourage you to get the vaccination because we really want to see everybody vaccinated against this deadly virus that is easy to prevent by a vaccination. We also want to answer your questions because there's a lot of unknowns out there and we can try and answer as many of those questions. And it's important that if you feel sick, you stay home, wash your hands. If you need to get tested, and continue to be vigilant. So you guys have done a great job responding to this worldwide pandemic. We encourage you to continue to monitor yourselves, monitor your patients. If you see anything that's concerning, please protect yourselves. That's very important. If you have any questions at all, please let your medical director know. We're always happy to answer them. Be safe out there. You guys are doing an awesome job. Please continue the great work.